We apologize, we did not make regular videos for you in 2021, but this year 2022 we will try to give you a brand new video every day. So in this video we are going to discuss the aspirin drug, but before we start, if you haven't subscribed to the channel, so subscribe to it and hit like button. Let's get start. Aspirin is an NSAID, non-steroidal anti-inflammatory drug. It has anti-inflammatory, analgesic, antipyretic and antithrombotic activity. It interferes with prostaglandin synthesis by irreversibly inhibiting cyclooxygenase. It was synthesized in 1853, but the drug was not in use until 1899. The name it was coined from the German word for the compound, acetylspearsor. Because of its greater efficacy and lower cost, it rapidly replaced the natural products in use at that time, and has remained one of the most widely employed remedies for over 90 years. Now the indications. Aspirin is primarily indicated in conditions like fever, following coronary bypass surgery, headache, inflammation, ischemic event, unstable angina, myocardial infarction, mild to moderate pain, myocardial infarction prophylaxis, pain and inflammation, in rheumatic disease, in other musculoskeletal disorders. Prophylaxis of cerebrovascular disease, pyrexia, stable angina pectoris, stroke prophylaxis, and can also be given in adjunctive therapy as an alternative drug of choice in arterial thromboembolism prophylaxis, colorectal carcinoma prophylaxis, juvenile rheumatoid arthritis, neurogenic bladder, osteoarthritis. Contraindication. Aspirin is contraindicated in conditions like GI ulceration, hypoprothrombonemia, and hypersensitivity. Now side effects. The severe or irreversible adverse effects of aspirin, which give rise to further complications, include urticaria, GI bleeding, rhinitis, angioneurotic edema, hepatitis, hepatomegaly. Aspirin produces potentially life-threatening effects which include cerebral hemorrhage, airway obstruction, gastric ulceration, gastric erosion, which are responsible for the discontinuation of aspirin therapy. The signs and symptoms that are produced after the acute overdosage of aspirin include coma, acidosis, hypothermia, volume depletion, hyperglycemia, renal failure, hyperventilation, cardiovascular collapse, vertigo, tinnitus, hyperkalemia. The symptomatic adverse reactions produced by aspirin are more or less tolerable, and if they become severe, they can be treated symptomatically. These include dizziness, vertigo, nausea, vomiting, tinnitus, epigastric discomfort, dyspepsia, asthma, respiratory alkalosis, and bleeding. Warnings are: aspirin should be used with caution in patients with chronic renal insufficiency, gastric ulcer, severe anemia, and patients intolerant to salicylate. Avoid aspirin in patient with history of blood coagulation defects and if patient taking anticoagulants. Liver function should be monitored in patients receiving large doses of aspirin or in patients with pre-existing hepatic disease in order to prevent reversible, dose-dependent hepatotoxicity. Now high-risk groups. Drug should not be given to pediatrics, pregnant mothers, patients suffering from kidney dysfunction, patients suffering from liver malfunction, and neonates. If prescribing authority justifies the benefits of the drug against the possible damages, he or she should re-evaluate them and consult the reference material and previous studies. Now dosage. Adult dose for inflammation is 0 to 45 mg per kilogram, single dose is 22 mg, frequency is recommended, and the route is oral. Dosage for mild to moderate pain, pyrexia, migraine, and dysmenorrhea, dose is 600 to 900 mg, single dose is 750 mg, frequency is 4 hourly and route is suppositories. Now the brands are Asgard and Disprin. I hope you guys like the video. If you like it, so subscribe to the channel and don't forget to hit the like button. See you in my next video with new drug.